Everyone wants, physical therapy now. You have to get an x-ray first. So they want all these details. And, if it's a plan that doesn't require that prior authorization and they don't have the details, you're not going to get paid on the back end. So even if it doesn't necessarily require that vetting, if you don't do it, you're not going to get paid. So I think a lot of things have changed just where the insurance just wants more and more information before they approve things or before they say they're going to pay for things. And again, how do you get that without being completely intrusive and asking so many questions to the patient? Like, how can we think a little bit smarter with the data that we have to get the answers that we need to get paid?
Rachel, thanks so much for joining us today. We appreciate it. We'd love to just start by understanding your background, how you got into healthcare, and what do you do today?
Yeah, so started front desk check-in at an imaging center, Precision Imaging, and then really just moved into a lot of different roles, kind of moved to the back where the TAs are helping get clinical information, managed the front desk for a little bit, assisted the radiologist on clinical concerns, liaising with our referring providers, and then moved into the call center, scheduling atmosphere, and now with authorizations, eligibility, and all of the cost estimates. So got to move into a lot of different departments and kind of see how everything works together to make a patient experience.
That's awesome. Now, what does a day in your life look like, right? For folks that don't know or folks that have more experience on the clinical side or the revenue cycle, what does your day look like?
Yeah, I mean, really listening to employees, listening to patients, looking for problems before they start, trying to be preventative as possible, and really making sure if we do get feedback on something that's not going right, like what can we do systematically to change it versus just sending an email to somebody like, hey, you did this wrong. Like, what can we change within our workflow and our systems to make it to where that experience can't be repeated again? And that's really from the moment a patient calls into our center to the moment, they get their radiology report. Like, what can we do to streamline that process? And then ultimately their bill.
Awesome. And what does your team look like today, right? If you had to say, like, these are the biggest functions, and how do you spend your time with the different teams?
Yeah. So, I mean, we have our operators, our tiered schedulers, because we have different types of modalities. We have our authorizations department, pre-registration, verifications, intake. So, I mean, so many different teams. I'm really just doing one-on-ones, like checking in on them. And again, it's really like engaging on how can we make systems better? Like, what is something that you're running into every day where you're like, this is slowing me down, this is creating an inefficient process, and seeing, is there something we can do to fix that? Or like, what is our workaround to try to make it a better process for the employee and the patient?
Yeah. And, taking it all the way back, you actually started on the front desk and you did the job for a sort of a little bit of time. And then you got into leadership, right?
Yeah.
What was that transition like? What did you do to get into that role? Talk to us about that.
Yeah. So, I mean, honestly, I kind of got pulled in a little bit where I was that front desk person like, hey, this is causing a bad experience for a patient. Like, this isn't seamless. Patients are upset. Like, what can we do to make it better? So I was that person like, hey, I have a solution, or hey, I think we should look into this more. And they kind of pulled me into the preventative side of things where it's like, go look for problems, go look for, things that aren't going right before they blow up in our faces. And then that's how I kind of got pulled into, the leadership side of just really trying to not wait for things to become a massive issue within the company.
Yeah, that's awesome. It's almost like when you're clinical and you're trying to make a diagnosis, you want to be preventative. It seems like you did the same.
Yeah. I'm like, let's not wait till they're here and we don't have authorization. We've given them the wrong estimate. We've scheduled them for the wrong test. Like, what can we do ahead of their visit to make that not occur when they arrive at our facility?
And when you talk about the breadth of teams you're leading, it's impressive. And I think it's almost like this orchestra that you have to conduct, right? To get things right all the way down, to get that right patient estimate, to get the right bill, to make sure it's a great customer experience. What are the insights that you have in running this team that's allowed you to be so successful? I mean,
really being on the front end and doing it myself. I think you have a lot of managers who come in and haven't got to do the job. So then they don't really know what they're working, towards and what a real day in the life is like. And then also just having really strong staff members, really strong, supervisors, team leads, all of those people really help contribute to the patient experience and making it feel engaging. If you don't have a happy employee, you're not going to have a happy patient. So really creating a happy team to make it.
Yeah. And the scale you operate at today, I'm sure you've been there from the point where it's grown quite a bit as well,
yes.
right?
Yeah.
Where I think, if I remember correctly, it's like thousands of, probably tens of thousands of appointments a week. It could be an estimate, but
yeah, I think about 600 a day. So
600 a day, yeah.
Yeah, just 700 on a busy day.
Yeah, so call it 3,000 to 4,000 a week. What are the processes and things you've put in place to allow you guys to scale, right? Because that's very different than running a group that's doing 10 or 20 a day.
Yeah, I mean, I'm trying to think of things that we've improved upon since I started. And, some of it was departmentalizing a little bit, like the breast department. I mean, breast imaging is so important, obviously, breast health awareness and all of that. And really trying to get people who are doing very specific positions to be like, the master of that position and not so much make it to where other people can't help, but really just making sure we have the right people knowing the right knowledge that can give the patient the right information. System-wise, it's really been about building rules since I came into authorizations and verifications. There's so many things that I guess were going to the billing side that never got brought to the front end. Like, hey, every time this patient comes in, you're estimating it wrong, and this is why. How do you apply a rule up front to get the right estimate? None of that was really happening before I stepped in. So really reviewing EOBs and seeing what can we do to apply this up front to give the patient a right cost before they get the bill.
Yeah. And maybe talk a little bit about the tooling, because I think that's where some of the work we're going to be doing together, I'm really excited about, right?
Yeah.
Ideally, every single time you see an issue, you put in a rule, but it's never that simple, right?
Yeah. I mean, sometimes the rules are really straightforward, like, hey, we're a preferred imaging partner, so this is the copay it should always be. But sometimes it's really, we cannot determine why the copay is what it is, but it's always this copay and just trending their visits. And I think that's something we really lack right now. And we're hoping you guys can kind of come in with, your AI solution and say, hey, we're trending like the same occurrences are happening. You might want to apply this, even though we don't know why. You're never going to understand all the algorithms with the insurance and what's going on, but we notice the same patterns occurring, and this is what we would recommend to implement to make the cost right.
Yeah. No, I think that makes sense. And then you spoke about the relationship you have with the RCM side. Maybe talk a little bit about that and how it's a little bit of a back and forth, and again, working together to make sure the patient has the best experience possible. Yeah.
So RCM's a little new to me. I just kind of got into it within the last year. And like I said before, I kind of always butted heads with RCM, where it's like, this is the front end. This is, some of the stuff RCM asks is not realistic to obtain on every single patient every time. So what can we do to make the patient experience as best as possible and not so intrusive, where it's like asking them 18 questions before they even come into the practice about, cost estimations and insurance and, all the qualifications they need to be able to get a scan paid for. So that's where it's really just trying to find a healthy balance. Like, what limited amount of information can we obtain, but still give an accurate estimate and not overwhelm the patient?
Yeah. No, I think that makes sense. And in the time that you've been in this and the relationships you've built, what has that looked like, right? Because you have 4 minutes, 5 minutes on the phone with the patient. Yeah. You get what's the most important, because otherwise they're going to go schedule somewhere else, right?
Yeah. I just think it's completely unrealistic to ask a patient just all these questions about their insurance. And like I explained to you, I'm driving sometimes when I'm scheduling, I'm trying to find my insurance card and give them all this information. So something we did apply recently was, a rule where if eligible pulls back the carrier detail, it reads a certain line and it just flips it to the right carrier. So it's not so much me as a scheduler having to select the right carrier. Eligible is pulling back the plan name and then updating it within our own system to the right plan so that it gives the right cost. So that was a huge thing we struggled with Blue Cross, was really just getting the right plan selected without having to ask the patient, what's the plan name? Is it a PPO or HMO? Yeah. What's the PO box on the back? Yeah. It's just, if they don't have their card right in front of them, well, now they have to call back to schedule. Now it's a second call. Now it's more work. So just trying to make it, and that's something we were able to do with Blue Cross, is just write a rule to read the plan name from eligible and then update the carrier in our system. And it gave us a more accurate cost.
Yeah. I think that makes a lot of sense. And what I'm curious about is, how have you seen, especially some of the payer regulations, change over the last, you've been in it for 10 plus years at this point, change and some of the responses you're getting, and like you mentioned, it's a little bit of a black box sometimes in terms of how much they're going to pay. How have you seen that change? I
mean, again, I'm kind of new on the RCM side of it, but like some things we've seen changed. I deal with, again, the front end. So prior authorization, like everyone wants, physical therapy now. You have to get an x-ray first. So they want all these details. And, if it's a plan that doesn't require that prior authorization and they don't have the details, you're not going to get paid on the back end. So even if it doesn't necessarily require that vetting, if you don't do it, you're not going to get paid. So I think a lot of things have changed just where, the insurance just wants more and more information before they approve things or before they say they're going to pay for things. And again, how do you get that without being completely intrusive and asking so many questions to the patient? Like, how can we think a little bit smarter with the data that we have to get the answers that we need to get paid?
And things like authorizations are so sensitive, right? Because if you get it wrong, or if you put in, it could be the difference between getting a procedure and not getting a procedure that the patient potentially is really, really important to them, right? Or of high need as well, right?
Yeah. I mean, it's not, I talk to patients all day where the insurance has denied their test, and it's not a fun conversation, and you don't want to blame it on the insurance. You don't want to blame it on the doctor who ordered the test. You don't want to blame it on us. So really trying to make sure, that we're educating the doctors, but not leading them to the answers of like, these are things you guys really need to think of when you're ordering tests, because we're submitting it on your behalf and they're going to deny flat out every time if you guys don't have certain criteria. That's been a challenge as an independent testing facility, is really getting the referring doctors who are sending us on board with understanding what are the requirements that we need to get paid so that you can keep sending patients to our practice.
Yeah, that makes sense. And then how have you seen the change of plans, right? Because that's what you're really familiar with, right? So a lot more high deductible plans, more out of pocket. Tell us about that.
Yeah, I mean, definitely a lot more high deductible plans. And it's crazy how little a lot of patients, understand about their insurance policies. But yeah, the deductibles are tough, and, just determining if they're going to meet it at the end of the year or before the end of the year. So we have a lot of people cramming things in, around November, December, because they've met deductibles. But yeah, I mean, when you're off on a couple $100s on a test because you applied the wrong plan, it's definitely a big deal to patients. So it's like when you go to a restaurant, you don't just order something without knowing what the price is. So I think being able to tell a patient what the right estimate is up front it really creates that trust relationship where they're not just going to send me some crazy bill at the end of the day. And obviously legally too, like we need to make sure we're giving them the most accurate costs and not surprise billing them.
Yeah. No, I think that finding that balance is so important. How do you think about patient education and getting them informed on, here's what it, like a lot of folks may not even know like what the difference between a deductible, copay, co-insurance is. How do you focus on that piece? It's
a really good question. Like we've talked about doing things where we send out, like what you're going to expect to come in for an MRI, but how do you educate them on cost and what to know? And I wouldn't come into, a tech world and expect to know things. And the same with like people coming in for mammograms, they're not going to know the policies and procedures and why we do things. So I honestly don't have the solution to how you educate patients more, but I'd imagine it's just really like engaging with them, sending out videos. Obviously, we have a ton of training for our own staff. It's just how can you then correlate it to help the patient? But I think from what I've seen, most patients learn more as they get older. Obviously, sometimes people in their late 20s, 30s, they don't have a bunch of procedures done. So you might think they know, but they may not know yet.
Yeah.
So I think once they learn it once, it's kind of something that sticks with them for a while.
And oftentimes when you read your bill, and I've gotten bills from when I go to the doctors, it says like adjustment amount and adjustment reason.
Yeah.
And it's not even English sometimes,
I know.
right?
Yeah. I just got used to looking at them. I'm like, I don't even know what all of the bills are crazy. I'm more, again, like on the front end of explaining things. But yeah, the bills to me, they're illegible sometimes. And it's really hard to tell, what is my insurance covering? What's the contracted rate? Like, are they even applying? Is it a co-insurance, copay? It is really tough. And I think just trying to get it like with breast imaging, you're required to send a layman's letter. Like, this is a basic understanding of your result. Why can't you do the same with that with a bill? Like this is
but it must be that your team ends up having to answer a lot of these questions, right? When patients call and they say what's going on and why do I owe this? And
that's more a best team on the back end, like for my end on the front end. But we do have to explain, not so much once they get the bill, but before they come, what are they going to look at? And again, when you tell someone something and then they get a bill for something else, why would that happen? You don't expect that to happen in retail and, the food industry. So why do we accept that in healthcare?
Right. What are you, switching topics a little bit, what are you most excited for with implementing technology across the stack? And where do you think most of the opportunity lies in the front end processes?
I mean, I'm really excited for the AI assist. I think that's going to be huge to just being able to communicate with more patients more effectively. I think anytime you have humans, there's room for error. To train everyone. I'm really excited for what that can do. And then really utilizing, technology to review EOBs and apply it on the front end. And I know I've brought that up a few times, but just how can we get it right up front? Like that's my main goal with the technology that you guys are going to bring to us. Yeah.
And some of the more recent work that we've looked at is, we have certain agents that can actually explain full balances.
Yeah.
Like, why does the patient owe this, or how much can they expect to pay? And have some of those tougher conversations, right? Such that it's not your front office or Bet's team having to have those conversations. So they may have to. There's a lot of interesting use cases there. And then specifically on the authorization side, I'm curious if you're excited about anything that's coming out there.
Yeah, I mean, authorization is like a beast to try to really create a software on. So I am really excited for what's to come with authorizations, and just being able to, like, a big issue for us is why submit something it's going to deny. It's just a waste of time. So being able to use AI to review a policy, compare it against the clinicals that are provided, like, what's the percentage of this actually going through? And then what can we suggest to make a change? That's something that we deal with all the time. You've delayed the patient's care by 2 weeks on something that was going to deny before you ever sent it out.
Yeah. That makes sense. And I want to ask you a couple things about the patient experience. One thing we hear about a lot in the partners that we work with, right, is to this point before, of patients being confused about, their bill, or they don't know how to read it, or they don't know the estimates. On the flip side, though, I'd love to hear from you on strategies you've used that help patients feel really comfortable. But more than that, what are some stories from patients where they've had a great experience, right? And how does that positively impact your guys' group, or maybe some of the interactions you've had? I'm just want to hear a little bit more about that.
I feel like most of our impactful statements with patients is really like the care that they receive from the moment that they call in, and just someone who actually cares about what's going on, which it'll be interesting to see how AI can do that. But yeah, I mean, just being able to be like, this is what we're scheduling you for, giving you the right prep instructions, giving you the right cost estimate, doing the right procedure, providing a great experience during that procedure, and then sending no bill, hopefully, because we collected up front, we were transparent, we set up a payment plan. I mean, I guess that's kind of future state, but I guess, I can't think of an example of current state. I mean, we get a ton of great feedback on staff, but I would say there are some things that we need to work on streamlining within our workflows.
And staff, meaning the folks on your team that help the patients.
Yeah. I mean, I think that's really like that personal connection, and, following through with patients and getting back with them. And, if you can't get the right answer, getting them to the person who can. Like, those are normally the patients that ask to talk to me and say, hey, this person really went the extra mile, and I didn't understand my cost, and they broke it down. Like, they got on a 3-way with my insurance. They really made it a good experience. So that's kind of the things that I get compliments on with the team.
And that's the stuff that matters. That's the thing that keeps patients hopefully coming back and referring and growing the business, right?
Absolutely.
Helpful. What is, maybe just talk to us about one thing that you wish folks understood about your scope, right? Things that you take on a little bit better, right? Because I know you mentioned it, we know it really well. It's a tough role to take on, right?
It is. I would just say, we're all humans, and, people make mistakes, and obviously it's healthcare. It's so important. And I think a lot of people have this misconception that you can't make a mistake in healthcare, and ultimately mistakes do happen. And, our goal is, again, to learn from them and try to make a better process. And I think trying to get past the point of just, hey, let's email this person and give them feedback. Let's give them feedback. I don't really like the word feedback anymore. I'm like, let's make it better. Let's make it harder for someone to make this mistake again. Let's really push them into the right answer so that they don't do something wrong in the future. How can you guide your employees to make correct decisions with the information that they have?
Yeah. And what's your, as it relates to your team, I'm curious, your leadership philosophy and, things you do that you think has allowed your team to be really effective and efficient I'd love to hear about that.
Yeah, I mean, I would say servant leadership. Like, I'm really there to help them do their job great. And I also really like to interact and do the job with them. I'm not going to ask you to do anything that I wouldn't be doing. I'm going to jump in on the phones. If we have 20 callers holding, like, you bet I'll be answering the phone with you guys and helping and still answering chat. So yeah, I would say really just servant leadership and knowing that, I'm there to help them and answer questions and be a support for them.
Yeah, I love that. I think that is a unique trait when it comes to leadership, like being able to jump in and do the job with the folks around you. Like,
yeah.
I think it gains that's the way you gain a lot of respect.
Yeah, I agree.
And then how do you keep the staff motivated? I think that's the other question of leadership, right? Because it's a tough role. It's not easy, right?
Yeah.
What are things you do?
We try to do some incentives to make it fun. Hey, if we hit the certain amount of numbers, like, we'll do rewards, we'll do, parties. So I think a lot of the times what I look for when we're bringing people in is like, I don't want to not motivate my team because I hope they know I'm a super motivated person. I want to jump in. I want to help and, make everyone great and help them learn skills that'll help them outside of the organization one day, but also looking for people who are really just in their own confidence motivated. Like, it's hard to find, to motivate someone who doesn't have the initiative, but that's our job as leaders is, create that motivation. So that's some things we do is just really try to create targets and, camaraderie and, sending out, our chat groups and all of that. But I think, forced engagement isn't ideal. I think we're kind of like, we're turning in this culture of like forced engagement. Like, it should be natural. And that's what I'm used to. And I think more and more I keep seeing like, we're forcing like these relationships, and it should come somewhat natural. If you're, talking to your employees every day and you're doing the job with them and you're, there to help them, it should really be natural engagement.
Yeah. And how do you, one thing I think about a lot is kind of we hire and we grow our teams is how do you screen for that? Because I think it's easy to say in an interview, like, hey, yes, I care a lot and I'm going to work hard and I'm motivated. But what are things you've seen?
I don't know. I feel like I don't want to say I like have a sixth sense, but like, I can tell when someone like has a true initiative to want to grow. And normally I'm looking for people who don't have experience. Like, I want somebody fresh out of, school, like it could be high school. I came straight out of high school and got to grow a lot within the organization. I think there's a lot of things you can teach people if they have the right attitude and the right initiative and motivation within themselves to learn. So that's really what I look for is like, sometimes a clear slate of somebody who just wants to learn. All you want to do is learn, come here, we'll teach you and help you grow. So those are kind of what I look for when I'm interviewing.
That's really unique. So you take folks that don't have a background and you teach them like, here's how we do it. And you teach them about the space and
not to say we wouldn't take someone, great experience comes great too, but sometimes experience comes with bad habits and a bad attitude. And this is how I've always done it, and again, some people aren't like that, but a lot of the times people who are eager to learn are just, they haven't learned a lot yet. So they're very eager to learn.
Yeah. Wow. Very unique. And that's great perspective and something for us to think about as well. And we've done a little bit of that, but again, I think we also have a lot of folks from industry. If we take a step back and think about the next 5 years or 10 years, whatever time frame you want to think about, what are you the most excited about? Like, what keeps you going and excited and motivated? Like, what are you trying to build towards?
Really just like the best possible patient experience, like just really making it, again, I know I keep talking about like food industry and retail and like luxury hotels, but like, how can you make healthcare into something that it's obviously not right now? Like, you want them to come in and feel like we care about you. We're here to help you. We want to tell you all the information you need to know. Ask us any questions. So really just moving into this atmosphere of like, healthcare, hospitality, we want to take care of you. We don't just want to get you in and out. We want to make it a great experience for you.
Wow. And what are the things that will get us there, right? Like, if you think about, like, I think I love that vision. And I think in many ways, we want to build a platform that allows you to do that across the entire operating suite of healthcare. Like, that's what we're focused on. Curious, what do you think the tangible steps to get there are? I really think it's leveraging technology to help your staff focus on patient care. So how can you make all of the back end work that is just
cumbersome to an employee, so that all they can do is put care on their patient and really know who their patient is and help them with what their needs are and have easy access to information that they need to answer their questions. So, just utilizing and leveraging the technology that we have to make the mundane work kind of go away or get easier, make more sense for everybody.
That makes sense. And of that, if you think about all of the different processes or kind of called products you oversee, where do you think the most opportunity is? It in the auth realm? Is it in the scheduling? Is it where do you think it is?
That's a good question. I think order management will be really interesting to see, because that just starts the process for a patient. And if you mess something up there, like typically the rest of their experience has been messed up. So I think right now, we've always had manual data entry, and it's just people who don't understand the clinical side, they don't understand the financial side. There's easy ways where I could say, hey, like, this doesn't make sense. We shouldn't be doing this test for this diagnosis. Like, it'd be great to have a system that just recognizes that. Like, hey, clinically, this doesn't make sense. Financially, this is not going to get approved, and then picking the right exams and doing it right to start. I think that's where I see the most effort, like, for the whole stream of things. Obviously, there's a ton of other stuff too, but just really getting it right at the beginning. I think that's the best.
And by people, you mean, is it like the lab techs, and is it the folks on your side? Like, or is it the referring providers? Or?
Well, yeah, the referring provider starts it, and you think they get it right to start, but that doesn't always happen. I don't think it, unless they get an amazing system, it probably won't. But really, it's just our team on site where they're entering data all the time. A doctor orders an MRI. Well, that you've got to put it in the system and schedule it. Well, why would I schedule an MRI that's not going to get approved? Or why would I schedule an MRI that maybe doesn't clinically make sense to do? They just had surgery. We should be doing this with contrast, not without. So it's just those little nuances of, let's get it to the best thing it needs to be before the patient comes in and we do the test wrong, or it's not going to get covered, or we're not, those kind of scenarios I think would be really interesting to see up front.
It's almost like those rules that you talk about, right? Yeah. But applied across the life cycle of
all the problems that you could see up front.
Life cycle of a patient. And I feel like you can only do that if you have one singular operating system where everything runs out of, right? Because I think if it's too many different systems and they don't talk to each other, it just makes it, I'm sure you've seen cases like that where it just makes it so much harder.
That's where we've been in, I feel like, for a long time. It's just using multiple systems. And I think that's why we're really interested in AIR. And I know it's not set yet for radiology, but we really want to get in a platform where it's all in one spot, because creating HL7 messages back and forth, that's what we've been doing for a long time. And it doesn't create a streamlined experience.
Got it. Okay, awesome. Anything else that you think is important to bring up? I think we're really excited to work together, but...
No, I don't think so.
Okay, awesome. Great. Well, thanks so much. I appreciate it.